Good morning, everyone. My name is Craig Ashcroft. I am a current surgical resident at Bay State Medical Center, UMass Chan Medical School. I want to thank the SAGES Committee for selecting our work to be presented here today. And I will be presenting on the effect of per-oral endoscopic myotomy by Achalasia subtype as measured by impedance planimetry. Here are disclosures for our team. I personally have no disclosures to share. So there are three recognized phenotypes of achalasia identified by high-resolution manometry and defined by the Chicago classification, all of which have impaired lower esophageal sphincter relaxation, but distinct patterns on high-resolution manometry that define them to their subtype. Type 1 has impaired lower esophageal sphincter relaxation with absent peristalsis and normal esophageal pressure. Type 2 shows impaired lower esophageal sphincter relaxation and total esophageal body pressurization. And type 3 has impaired lower esophageal sphincter relaxation and spastic esophageal contractions. EndoFlip has emerged as a tool to evaluate and guide therapy for achalasia. It's a catheter-based device that can be deployed and inflated in the esophageal lumen, utilizing impedance planimetry to measure diameter, cross-sectional area, and distensibility index, where distensibility index is defined as cross-sectional area divided by the balloon pressure. These metrics can assess and the extent and completeness of the myotomy intraoperatively. EndoFlip use intraoperatively has been correlated with good clinical response. While esophagogastric junction distensibility with EndoFlip has been demonstrated to help characterize subtypes of achalasia, no studies have investigated the effects of POEM on different achalasia subtypes as measured by pre- and post-POEM EndoFlip. We hypothesized that achalasia types 1, 2, and 3 would have differing pre-POEM distensibility index and diameter, but no differences in distensibility index or diameter post-POEM. Direct comparisons of pre- and post-POEM EndoFlip values may help elucidate if a particular achalasia subtype responds differently to POEM, or support if POEM is equally efficacious across all achalasia subtypes. So this was a single-center retrospective review of consecutive POEM cases from patients from June 2011 to August 2023. Inclusion criteria included POEM cases performed for achalasia having both pre- and post-POEM measurements of diameter and distensibility as measured by impedance planimetry. Exclusion criteria included any cases that were converted to a laparoscopic hilar myotomy, cases without pre- or post-POEM impedance planimetry values, or any cases performed for non-achalasia dysmotility disorders. All patients underwent pre-procedural high-resolution manometry, and patients were divided into achalasia subtypes characterized according to the Chicago classification. So for our results, there were 64 patients who underwent POEM for achalasia with pre- and post-POEM EndoFlip performed. When stratified by achalasia subtype, there were 9 type 1 patients, 36 type 2 patients, and 19 type 3 patients. In our univariate analysis, our data did show variability in pre-POEM distensibility index and diameter between the three subtypes. In post-POEM measurements of distensibility index and diameter, this variability did not persist. And this suggests that POEM is an effective treatment for achalasia regardless of the subtype. To adjust for potentially confounding factors, a multivariable linear regression was performed that included the significant factors from the univariate analysis. We did not find a statistically significant difference between the pre-POEM and distensibility index, nor in post-POEM distensibility index. Also, in pre-POEM and post-POEM, diameter did not show statistically significant differences in the multivariate linear regression analysis. So to summarize these last statements, when specifically looking at achalasia subtypes, the previously significant factors of pre-POEM diameter and distensibility index in the univariate analysis did not persist. Sorry. So to conclude, we present a retrospective study investigating the direct effects of POEM on different achalasia types by comparing intraoperative EndoFlip parameters before and after myotomy. This is the first work to directly investigate the effects of POEM in different achalasia subtypes using intraoperative EndoFlip to measure distensibility index and diameter, seeing the direct effect of POEM in real time on achalasia subtypes. We originally hypothesized that achalasia subtypes would demonstrate variability in pre-POEM EndoFlip values, and this variability would be absent post-POEM, and we did find this to be true in our univariate analysis. However, after our variable linear regression analysis, we were not able to statistically find a statistically significant difference. Our data is valuable for the surgeon or endoscopist using POEM and EndoFlip because while achalasia has the three described subtypes via high-resolution manometry, it does not demonstrate differences in pre- or post-POEM desensibility index or diameter between the subtypes as measured by EndoFlip. And because our patients have similar pre- and post-POEM Eckert scores with robust response in their Eckert scores post-op, it further supports that POEM is an effective procedure in the treatment of achalasia, and one can expect similar excellent clinical outcomes regardless of the achalasia subtype.
Thank you.
Thank you.
Thank you.